with doctors. We're connecting with community experts. We're connecting with you. This is Connect by 3 News.
Hello again, and welcome to 3 News Connect. We made it to Wednesday, or Monica, as I like to call it, halfway to Friday. We are hosting from home, as we have been for the last better part of 3 weeks. With Monica Robbins, I'm Jay Crawford. We are here each day at noon as a resource to you. We want to answer your coronavirus questions. We also want to bring you the very latest developments in the fight against the pandemic. Monica, hello. I hope you're well today.
I am well. I'm glad to see you're well as well, Jay. There you go. Of course, the information about COVID-19 is constantly changing, so let's get right to the latest headlines. The number of infections here in the U.S. are nearing 400,000, and they topped 1.4 million worldwide. And we are learning 195 million full-time jobs could be lost worldwide as well. The UN's projection is for the second quarter of the year. And Wuhan, China, where the pandemic began, has officially ended their lockdown. After 11 weeks, Chinese authorities are moving to allow residents to once again travel in and out of the city, which has been used as a guideline for other areas battling coronavirus. Jay?
Monica, a big announcement yesterday from Governor Mike DeWine. 167 inmates in Ohio will be considered for emergency early release because of the pandemic. The governor has cited a statute that allows inmates to be let out due to overcrowding. They carefully selected these inmates. The bulk of them, 141, were due for release in the next 90 days and are over the age of 60 with a chronic health condition. None are either violent offenders or sex offenders.
During this pandemic, when you order a meal from a restaurant, and if they have a liquor license, you will be able to get up to 2 drinks.
And there it is. That is music to many's ears. Customers told restaurants, restaurants told the governor, and the governor took action. You can now order some adult beverages through takeout. It has to be pre-packed. It cannot be opened until you get home. But this is just another way to help restaurants that are suffering because of the coronavirus. Well, new unemployment numbers will be released tomorrow, and as those numbers come out, we are expected for them to dramatically rise once again. We're now getting a look at just how many people are calling to try to get help. This is astounding. Listen to these numbers. The Ohio Department of Job and Family Services in the month of February received 112,000 calls. That number skyrocketed by a multiplier of 15 last month when they received more than 1.7 million calls. As you might guess, that kind of surge has overwhelmed the phone banks, so the governor plans to staff the call center with 1,000 additional employees by the end of this week.
Wow. Well, you know what, Jay? Any parent can tell you it's difficult enough adjusting to life with a newborn baby at home. But for one local couple, that adjustment is far challenging even more after their 2-week-old tested positive for coronavirus. Will Ewick has their story.
Felt completely shattered because at this point, it was my worst fear.
This is supposed to be one of the happiest times in the Clancy house.
March 23rd at right about 5 a.m. in the morning.
Because just a few weeks ago, they welcomed baby Eli into the world.
It was a hectic, very, very long day.
We made sure that we kept our family away, our friends away, everything.
Despite all their precautions and care, just days after returning home with their newborn son, Sean began to feel a cold coming on that turned out to be something worse.
I thought I was just lack of sleep, tired, worn down, so I thought I was getting a sinus infection. Got swabbed Sunday and then positive results on Monday, jaw dropped. I couldn't believe it.
I felt like now it's just up to me to keep him and also my daughter, who wasn't showing any symptoms, safe.
They're not sure if Eli was exposed at the same time Sean was or if he was exposed later. But despite Sean quarantining himself in the basement, Eli started showing symptoms and tested positive a week later.
My world got rocked. Here I am, sick myself, banished to the basement, sad emotionally, and then he's got it.
Needless to say, it's been an emotional roller coaster.
So now baby Eli spends most of his time isolated in the basement with his dad. And everything Dawn does, changes, feedings, or even seeing her newborn son.
It's an unreal feeling.
She does so with a gown, gloves, and mask.
I look down at him and he sees me and I know he hears me, but I just feel like, oh my God, he's looking at me. I have this mask on. It's been really tough.
They're hoping to reunite as a family soon, and that their story will help those struggling realize it's a tough time for everyone.
We haven't even been able to take a family photo together.
But happier days are on the horizon.
This is one of the worst possible things I'm sure you can go through.
Will Ewick,
I can't wait for it to just go back to normal.
3 News.
Wow, unbelievable, and proof that no one is immune. And with many dealing with a loss of income during this pandemic, we've seen communities stepping up to help. And tomorrow there will be another food drive distribution from the Greater Cleveland Food Bank. It's going to be a drive-through, and it will take place in the Muni lot from 2 to 6 p.m. And you must be pre-registered. We have the details on our website, WKYC.com. Jay?
Monica, with so many of us working at home, we're quickly realizing that it's not so easy to duplicate the comforts of our work office here at home. In fact, a lot of people have been suffering from back and shoulder pains. It's very important that before you start your computer work, you are comfortable. One way that you might want to change all of that is try to use a standing desk. I know, Monica, you said yesterday that you missed your standing desk at work, and there's a way that you can duplicate it at home. You don't need a fancy desk like the one you see in this video. We talked to a physical therapist from Metro about how to create a standing desk at home with things you probably already have.
A couple friends have sent me photos of how they have improvised and using boxes from Amazon and propping up their keyboards with those boxes, propping up their mouse pad. If you have a desktop computer, raising your monitors up to eye level when you're standing.
All right, take a closer look at this picture. They actually use upside down trash cans to raise each computer monitor up to eye level. Whatever you have to do. We want to keep you up to date with the very latest facts on the coronavirus and its impact. To get a direct link to our coverage sent right to your phone, everything you need, just text the word FACTS to 216-344-3300. 3 News Connect taking a quick break. We'll be right back.
Have you heard? Mortgage rates are at an all-time
A lot of attention. The president and CEO of Metro Health Medical Center shared a new prediction about coronavirus cases locally and for Ohio and whether we can avoid a surge. He gave me his statement exclusively for broadcast.
Modeling done by the Metro Health system suggests the peak for COVID-19 in Cuyahoga County may be significantly lower and the number of infections than originally expected, and that the county could see sustained impact driven by clusters of infections rather than a single large surge. The leadership of Governor DeWine, Dr. Acton, and others have saved lives and radically altered the spread of coronavirus. The public distancing response is historic and has changed the trajectory of the infections from being driven by widespread communal transmissions. Instead, we have infections and clusters of people in close contact. The bell-shaped curve that people have seen numerous times assumes widespread contact and are not applicable to rigorous containment efforts. In contrast, the jagged sustained curve predicted by Metro Health's model are based on network effect and contact limitations. The models were developed to help Metro Health prepare for and respond to the COVID-19 epidemic in our community. The Metro Health models show new infections in Cuyahoga County gradually increasing until around late April, followed by irregular outbreaks in clusters throughout the year. A similar pattern is expected statewide, with Ohio having significantly lower number of daily new infections than previously expected, and continuing at a flat rate throughout the remainder of the year. The importance of social distancing cannot be overstated. These models do not mean people can or should go back to life as normal. In fact, our models assume that people will continue to stay home if they have symptoms, frequently wash or disinfect their hands, not touch their face, and stay at least 6 feet apart when in public. If we were to become lax or immediately go back to numerous unprotected contacts, the bell-shaped surge would return. Metro Health physicians and public health officials have already observed clusters of infections involving people who have attended funerals, after religious celebrations, in nursing homes, the county jail, and confined workspaces. A lower number of infections obviously results in fewer deaths and hospitalizations than unfettered community-wide infection. I credit Ohio's leadership on social distancing practices for lowering acute number of infections. I also believe the model should be viewed in context of the overall health of Cuyahoga County and Northeast Ohio. These models have serious policy implications and raise important questions about how to best provide health care to our community. If this scenario continues to play out over the next several months, one question we as healthcare leaders must address is at what point should we resume preventive screenings such as mammograms, colonoscopies, and stress tests? We will need to provide healthcare treatment that is now being put on hold, while at the same time containing the spread of coronavirus. The state of Ohio ordered the cessation of elective surgeries and most preventive screenings in mid-March as a part of an effort to reduce the number of people coming into the hospital and potentially spreading the virus. That decision also helped preserve personal protective equipment and blunted the spread of coronavirus. It is too early for us to declare victory, but this is a signal that here in Northeast Ohio, we might be in a difficult, sustained campaign instead of a relatively short but intense war. We will need to figure out how best to care for our community, and we will continue to focus on providing the best care for our patients, our caregivers, and our community. I think the vigilance that we need to have in the future and we've had in the past is a great lesson for us to maintain the spread of the coronavirus.
Now, Metro's peak predictions are quite different than the Ohio State model Dr. Amy Acton has been using. And I reached out to her for a comment. So far, Jay, I have not heard back from her, but we'll hear what she has to say during her press conference today as well.
Monica, I know models are predictions based on the data that we currently have, but these models are different enough that it really makes you wonder, which one do we believe? Which one do we most trust? Are there other models that you're seeing that closely resemble either Dr. Acton's or Dr. Boutros?
You know, I think initially they all started looking like Dr. Atkins, but now the Ohio Hospital Association and Cleveland Clinic both say their updated models are resembling Metro's as well. And I asked Dr. Boutros a few questions about his models and what it means for the rest of us. And essentially the focus is that this is going to be a long war, not one big battle like that bell curve demonstrated. And we're going to hear more after the break. We'll be back.
I don't need to tell you that these are tough times. Let's remind our
Passover, typically a time of gathering with family and friends, but obviously this year the Jewish holiday will be very different as families come together while being physically apart. Families and groups we talk to say they plan to use services like Zoom to connect. However, as the Orthodox community does not use technology at this time, one rabbi told us while it will be an isolated Passover, saving lives is the most important thing. Monica?
Thanks, Jay. As we told you earlier, new data from Metro Health suggests Ohio's peak infection rate with coronavirus could be much lower than expected. And the Ohio Hospital Association and Cleveland Clinic models are looking similar. Now, I spoke exclusively with Metro Health CEO and President Dr. Akram Boutros for television about what exactly does that mean.
Is Ohio different from the rest of the country based on your model?
Ohio is different in three ways. The first is that the governor and Dr. Acton took decisive actions really early. And if you remember, we had the first press conference on coronavirus with them at Metro Health to talk about what needed to happen. The second is that Ohioans have been really diligent about staying at home and following orders. And the third, we don't have major international traffic through our airports. So therefore, we did not have a lot of introduction of a large number of cases of coronavirus early on. Like New York has 3 major airports, LA has major airports. Michigan, Detroit has major airports. And I would say to you, one of the criticisms that the governor and others took, which is about postponing the election. Michigan did not postpone the election. They had people come out, and I think you're seeing the result of Michigan having a significantly higher number of cases because they did not postpone the primary, and where you're seeing our numbers in Ohio significantly lower.
Are you expecting Ohio State's model to eventually resemble what yours looks like?
I think by the end of this week, many of the models are going to coalesce to look fairly similar to ours.
Why do you think African Americans are testing higher in numbers than any other demographic?
There are a lot of myths around there that African Americans are immune from the disease. That is not true. I think people need to continue to manage their own behaviors on social distancing, irrespective of race or religion. And I think one of the worries I have is that there's a higher prevalence of hypertension, diabetes, and heart disease in the African American community in Cleveland and in the Latino community than it is in the white population. So therefore, we're going to have people that are more symptomatic and require more admissions and are going to get significantly more ill because of the underlying conditions, not just because of race.
Now, the big message here is that we cannot stop what we're doing. Physical distancing must continue. But Dr. Boutros says his model shows we will see clusters of surges here and there over the coming months, but not the massive surge originally predicted. That's because Ohioans have been so diligent about sheltering at home, Jay, just like you and I have been doing. It is working. Unfortunately, for other states that did not plan, they may see those giant surges ahead.
Yeah, I saw an interesting study yesterday, Monica, that showed that Great Lakes states in our region, tend to be following the physical distancing orders more so than other states. I found that interesting, if nothing else. And one fear that I have here is that now that we're starting to get bits and pieces of good news, like perhaps these projections originally were high, that people will start to forget about those social distancing rules and go back into public. And that's what fears me most, because all of the experts say these models are done based on the people staying in shelter and staying at home. And if that curbs, then you're likely going to see that spike right back up. So I hope these orders stay in place, and I hope Ohioans continue to shelter at home.
You're exactly right, Jay. That is the big concern, because we could see a huge surge if people do not continue sheltering at home and following these rules that we've set in place, because obviously, based on our numbers, we know it works and it's proving to work.
Very good. Well, we all need a laugh. We have throughout these times. And when we come back, we're going to show you a really cool parody video that someone put together on Dr. Amy Acton and our governor. It's something you have to see because it will make you smile. We'll be right back.
We all have that list of home improvement projects
is giving back with their new Heroes t-shirt. They've teamed up with the university hospitals and the Cleveland Clinic, and I love the design. It says there is a hero in all of us, and it has a stethoscope around the neck. 50% of proceeds will go to funds set up by the healthcare systems and will support caregivers working here in Northeast Ohio. The shirt is available on their website for $25.
Well, if you ever thought Governor Mike DeWine and Dr. Amy Acton deserved their own theme song, well, you're not alone. Stofka created a limited posted animated video. You got to check this out. It shows the two keeping Ohio safe during the COVID-19 pandemic.
1, 2, 3, 4, 5, 6 feet apart. Stay home. Stay home. How's about we coordinated?
We're gonna do it. Give us any cure, we'll take it. Offer us your hand, we'll shake it. We're gonna make those things go through. Do it all right.
So the DeWine and Amy theme song is a parody of the opening title of the popular 70s sitcom Laverne and Shirley. Lieutenant Governor John Husted and sign language interpreter Marla Berkowitz are also featured in the video while providing some laughs for those watching it. It also reminds us all to stay home and stay safe. We got a chance to talk with the video's creator, Dave Stofka, who says this project is one he is most proud of.
I've never had such a large reaction to anything I've done, a large audience. So that's been very humbling and very rewarding because, you know, my goal was just to make people smile. And, you know, it was actually my first goal was to make me smile, to get me out of the dumps. And then hopefully other people would smile too.
Dave said he was inspired after he saw how many people were tuning in for the daily briefings and creating events like Wine with DeWine and Snackin' with Acton. And he said making this video helped keep him from worrying. That's awesome, Jay.
It's pretty good.
You
I
can't help
imagine
singing
people under
along
40
to it
don't
either.
get it. It's great.
Yeah,
I love
probably not, you know, unless they're watching the old sitcoms on TV, but you and I did, so.
We get it, and it's
hey,
funny.
thanks everybody. Thanks so much for joining us. We'll see you again at noon tomorrow for 3 News Connect.
And What's New is coming up at 5 o'clock this afternoon. Betsy Kling and the 3 News team join me for the very latest on the coronavirus headlines. We'll see you then.
After 2 weeks being closed for the health and